Hey there. I had such an interesting meeting with a family this week, and I wanted to tell you about it. This family came to me in search of a third opinion. So they had been to see a couple of other speech therapists. They have a young child who's not talking yet. Everything else seems to be fine. And this is pretty common among the kids who come to see us at SpeechKids. Everything seems to be developing. You know, they're walking, they're eating. Maybe they have some sleep disturbances. Maybe they've got mild allergies. Maybe they've got, like, I don't know, weird eczema, or maybe they were premature. So again, like, maybe there's like something little in the history, but nothing that would alarm anybody until they reach 18 months, 2 years, and they're not talking. And so this family came to me and they said, well, what do you think? And they told me what the other speech therapist had said. And here's what I told them before I said anything. I said, here's the thing. There's no one right way to do speech therapy. There's no one right lens to use for all the kids. And so, with that in mind, here's what I think is going on. And it turned out to be like a third thing, which was related to the first two opinions that they got. But, and the point here is not like, who's right, because there is no right. There's only what we can see and what we make of the pieces of evidence that we have, and how that matches against what we've seen before as clinicians, and what we know, again, what we've seen before and what we know about certain symptoms. And so it means that, and this can be really frustrating for parents, because they're like, well, just tell me the answer. Like, is it blue or is it red? And the fact is, we can't, because every child is different. And so there are things about temperament that are going to affect a diagnosis and treatment. There are things about motor development that are going to affect diagnosis and treatment. There are things about speech and language development that are going to affect diagnosis and treatment. There's things about play and social and all of these, and cognition, the thinking, that are going to affect how we interpret what we see. And so based on all of that stuff, and we like throw it all in the pot, we sort of come up with a working theory, and then we apply some therapy strategies and see what we get. And so here's what I wanted to tell you about today, which is choosing the right speech therapist is a bit of a challenge. And you really have to go on some basic kinds of questions, and then trust your gut. You know who the right therapist is for your child. And after a baseline level of qualification, and after you've asked, have you seen kids who kind of look like my child, who present in similar way? Once you've sort of ruled out a basic level of experience, then you've got to go with your gut. And you have to trust the person that you're talking to see your child and the complex, wonderful person that they are, to see the family constellation and all of that wonderful complexity, and just go with the way that it feels. If you have a yucky feeling about the person in front of you, they could be the most world-renowned expert in the diagnosis that you think your child has, or that your child might actually have, who knows. If you don't like that person and you don't trust them around your child, it's a terrible idea. It's a mix, right? It's the mix of the training, but then also the person. Because what we do is really highly interpersonal. And so we have to have that back and forth. You have to feel like you trust the person dealing with your child in order for them to make progress. And I would actually suggest that part of progress in therapy is driven by how you feel about the therapist, even though that sounds a little bit weird. And so trust your gut when you're looking for the right speech therapist. Go with that feeling. Again, get the baseline levels, but then trust your gut. Until next time, take care.